Ghana has signed on to the Universal Healthcare Coverage by 2030 agenda within the framework of United Nations Sustainable Development Goals. Well, this seeks to create a broad movement for accelerating equitable and sustainable progress towards universal health coverage. There are concerns inadequate and poor infrastructure, especially roads, can hamper achievement of this goal. Potentially, however, the digital age provides formidable options to surmount the hurdle. Love FM's Kwesi Deborah explores how telemedicine is impacting healthcare delivery in Ghana.
Most of the times when I'm not feeling well, when I feel like, oh, maybe I have a slight headache and I've taken a painkiller still, or I feel pains in certain parts of my body, the stress of going to the hospital to form long queues, I mean, it's time wasting.
Kwame Nkrumah University of Science and Technology student Bevelyn Kassoon cherishes the herbal side of medication. She has little or no preference for the hospital and therefore never hesitate to jump on the internet at the slightest knock of illness on her body.
If I'm not feeling well, I just go to look for natural remedies on how to, maybe, because I'm mostly stressed, so due to lectures and a few things. So I go there to look for remedies on what to do, what drugs to take to release the stress. So I think I do it every week.
For the 22-year-old, the internet provides an avenue to purchase drugs and even equipment for exercise.
It's quite stressful when you're wearing it.
She bought this waist trainer a fortnight ago.
I realized my stomach was becoming big, and I like going on social media. So one day I came across a page.
Bevelyn was convinced to buy the equipment she wears 6 hours every day after going through positive reviews online.
I realized like 1,000 people were giving, more than 1,000 people were giving positive reviews about this product. So I'm like, these are like so many people giving positive reviews. So that means it has worked for a lot of people.
A 2017 report on student internet use in 3 universities in Ghana found 78% are active internet users. The study, published in the International Journal of TeleMedicine and Applications, found 67% use it for health purposes. Privacy, confidentiality, and availability are major factors.
At
Kona is such a south district of the Ashanti region of Ghana. Residents do have the phone luxury. They seem to care about few things. Farmer Kwakunsia's phone was smashed 6 months ago, and almost all apps are dysfunctional. The junior high school graduate is nonetheless never bothered for as long as he can receive calls. Access to primary healthcare services in Ghana remains a challenge. A 2008 WHO report shows average life expectancy is about 10 years below the global average. Avoidable diseases such as cholera and malaria continue to burden the population. Shortage of qualified health professionals with very low doctor-to-patient ratio is a concern. The nurse-to-patient ratio of 1:959 in 2014 still falls below WHO standard. Poor roads and infrastructure in farming communities are huge barriers to quality health care. We've walked for about 8 kilometers, more than the 5-kilometer threshold recommended by the WHO for heavily
pregnant women. And there's no healthcare facility in sight.
Finding other simple ways of accessing healthcare has become necessary, a medium where people like Kwakunsia can easily have access: the phone.
Hello, good afternoon. TeleMedicine.
Local cocoa buying company Kweapa Cocoa and the Millennium Promise Alliance have been leveraging this for 4 years. Resident doctor at Kweapa Cocoa, Fred Bezra, says the initiative is meant to solve issues of accessibility and transportation constraints.
Cocoa farms are located in the hinterlands. There's accessibility issues as far as roads are concerned. And then, contrary to WHO standards, where after every 5 kilometers you should have a health facility, most of the farming communities don't have such luxury. So we've done mobile clinics, we've done central clinics and all. But we realized that the most effective, or one that would increase access tremendously, would be e-health. E-health basically meaning in use of ICT in provision of healthcare services, which telemedicine is part.
Farmers call directly to the center where nurses offer interventions within their purview or relay to a team of doctors. The center is in touch with their nearest health facility and refer farmers when necessary.
If we have been hospital, so pressure, normal take you from there. What is really wrong with you?
So far, 100,000 farmers have received phones from the company. Joe Sechi is in charge of ICT.
And on the average of 5 people per household, this center is serving about 500,000 household members.
Ghana's health system before 2003 ran on cash and carry system. For a developing country, it was hindrance to healthcare accessibility. The National Health Insurance Scheme was therefore set up to provide a sustainable and equitable social health insurance solution. It is expected the elderly, due to their vulnerability, will benefit from the scheme more than the youth. However, long queues for membership renewal at offices of the scheme is a burden to both old and young. Paul, for instance, last renewed his card in 2014.
I always find it difficult to go there because when I think about the queue every day, I just find an excuse to stay in the house.
Transportation costs and loss of man hours take a toll on retention and renewal. Research consultant Dr. Joseph Mafubuahin had envisaged a solution in his PhD thesis back in 2012.
So we are okay. If the mode of payment is the issue, then why can't we come out with something that will address this issue? So we thought it wise with my colleagues that okay, why don't you consider the use of mobile phones? Because checking the record from National Communication Authority, we realized that almost everybody in the country was using mobile phones. So I think that could be an avenue where people can use to pay national health insurance premium. And we have also heard that in Kenya, they were using it to pay health insurance premium.
In December 2018, the mobile renewal system was introduced as a method of membership renewal and premium payment. Kojo Chinebo is Ashanti Regional Manager of NHIA.
We noticed that from 2015, our membership figure was dwindling, it was falling. Currently, as we speak, the figure that we have achieved with the introduction of the mobile renewal service and with all the innovative strategies that we have adopted, we have reached a record registration figure of over 11.4 million members. And these are active members.
Though the system has boosted renewal and revenue mobilization, many more are yet to be enrolled. Gifty Boa, for instance, believes mobile payment is not secured.
I don't want to do the mobile NHIS because I'm scared.
For some people, especially the illiterate, the mobile system is complicated, for which reason they still troop to the health insurance office.
The NHIS has a Facebook account. We have all the other accounts, and we are also using them. But then, you know, the society in which we find ourselves, there are still a significant number of people who are not literate in terms of the use of ICT. So it is still necessary that apart from those platforms, we still use the traditional methods in educating our members to get them educated on some of these products.
A 2016 study on Health Economics Review revealed insurance premium may not be affordable to some members under the current payment system. The reason is irregularity in income streams of individuals.
If with the same technology, it can allow the people to pay in installment, I think that one would be better. Yeah.
Okay, so health-related phone applications are common in the country. Huali, Dr. Ghana, iDoc, and HealthMate, among others, make their way onto people's smartphones.
Right. So let's say it's lunchtime now. It's very quickly in lunchtime. So you get your normal food like wache and fish, wache and chicken wings.
Komfo Teaching Hospital announced an app in the offing at the launch of its social media platforms. Chief Executive Dr. Hinebo Usudanso believes it will facilitate healthcare delivery by ensuring a swift patient-hospital interaction.
Management is currently collaborating on the development of an app to further engage the public and would-be clients on our clinical services to facilitate a more reliable appointment system.
It is important to note deployment of apps comes at a cost, as some hospitals in the US and Australia have been bartered. Alabama and Victoria hospitals stopped accepting new patients after hackers attacked their computer systems. Jacob Pupulampu is Director of Cybersecurity and Digital Forensics at the Economic and Organized Crime Office.
When we go digitization, a lot of information go digitized. And if we don't protect them well, it means we're in trouble. The first step I want to recommend is that whoever the developer of that particular database is concerned has to seek advice if he has no. There are developers, all they know is to put pictures together, database upon database together, and out of it, you have the system for the hospital. But there are rules to these people. They have to make sure that the security aspect of whatever software they are developing is tightened and up to date.
The roles of phone and internet in the lives of Ghanaians cannot be underrated. As Ghana looks forward to justifying her contribution to achieving universal health care by 2030, it has become inevitable to promote e-health. It also means ironing out all associated hitches. Mass mobile education and strict internet security protocols are keys to gradually eliminating inefficiencies in the country's healthcare services. For JoyNews, Kwesi Deborah.